This chart shows a mid-sized practice's expected annual revenue, but thousands of clinics quietly lose up to $200,000 yearly in missed quality incentives. Those scattered dots represent the actual culprit: care gaps, patients overdue for routine preventive services and scheduled immunizations. These data points represent patients missing annual A1C tests or cancer screenings, individuals currently invisible to the schedule and slipping through the healthcare system's cracks. A missed screening eventually leads to worsening health outcomes for the patient, which becomes a compounding financial liability that threatens the operational sustainability of the entire practice. The standard response for most practice managers is to handle this internally. They assign existing nurses and front desk staff to pull reports and start dialing phone numbers. That approach creates massive operational friction. Hiring dedicated onshore staff takes 3 to 4 weeks and adds over $100,000 in annual payroll. Worse, the actual work relies on slow, manual data entry across disparate electronic systems. This progress wheel illustrates the typical ceiling for internal efforts. Despite the heavy investment in time and payroll, most clinics find their closure rates plateau at 30%, while their overhead costs continue to climb. Practice managers are left trapped in an impossible vacuum. They either burn out their clinical staff with administrative phone calls, or they permanently forfeit critical quality incentive payments from health plans. To understand why manual tracking fails, we have to look at the upcoming HEDIS 2026 quality measures. Health plans use these rules to grade clinics, and the compliance requirements are becoming strictly enforced. The new mandates heavily emphasize eCDS, or Electronic Clinical Data Systems. Health plans now require clinics to provide continuous, structured data pulled directly from electronic records. When nurses are forced to type notes by hand and manually update patient files, the data structure breaks down. Encounters are documented incorrectly, reporting deadlines are missed, and the eCDS requirements are failed. Surviving these strict new compliance standards means abandoning manual data entry entirely. Practices need a system that synchronizes patient data automatically. Staffingly solves this with a hybrid model. We deploy an outsourced team of virtual medical assistants, overseas clinical professionals working alongside advanced AI automations. We establish bidirectional API integration into existing EMR systems, like Epic or Athena. AI algorithms pull overdue patient lists, instantly sorting and predictively prioritizing by clinical urgency. Our remote team then attacks your list in parallel, running campaigns to close dozens of gaps simultaneously. By letting the algorithm handle the heavy data routing and EMR syncing, our human medical professionals are freed up to focus entirely on execution and patient connection. Pure AI robocallers might look efficient on paper, but automated voices often alienate vulnerable patient populations, especially seniors enrolled in Medicare Advantage. Instead, our multi-channel outreach across phone, SMS, and email is executed by real people. Your patients speak with trained medical doctors, U.S. licensed RNs, and PharmDs who can communicate in languages like Spanish, Mandarin, and Vietnamese. Because they are clinicians, our specialists know how to listen for hidden barriers. During a call, they can identify social determinants of health, like a patient lacking reliable transportation to the clinic, or struggling with food insecurity. By uncovering these daily life struggles, clinicians can intervene early to help the patient while fulfilling the complex new HEDIS social needs screening requirements for your practice. This line graph tracks the performance of this hybrid architecture. By combining API automation with human empathy, clinics can reach a 75% gap closure rate within 90 days. You achieve those closure rates while cutting your staffing costs by 50% compared to onshore hiring. And because the system is structured, your fully trained, dedicated team can launch in just 2 to 3 weeks. All of this operates under enterprise-level security. The entire offshore workflow is locked down through strict HIPAA compliance, annual audits, SOC 2 certification, and HITRUST processes. Closing care gaps protects the longevity of your patients and recovers the missing revenue your practice has already earned. Get a free gap analysis today and see exactly how much revenue your clinic can reclaim.